Hi everyone. Today I'm going to be presenting cardioglycosides and heart failure. My name is Jorge Salmerón Bernal and the class is Nurse 312. Cardioglycosides are also known as digitalis glycosides. According to Felicilda Reinaldo, cardioglycosides have been used in the world for over 2,000 years. The Romans and Egyptians used plants such as digitalis purpura and digitalis annanza to create natural medication. It was first used by William Whitring as contemporary medication in 1785 for the treatment of symptoms of heart failure, especially edema. Digoxin is currently the only cardiac glycoside that is approved for use in the United States. Digoxin is categorized as an inotropic as it allows for stronger cardiac contractions. This in return causes increased cardiac output. Digoxin can also be used as antiarrhythmic because it slows down the heart rate and also slows AV conduction. Digoxin is considered a pregnancy category C as studies have shown that digoxin is able to cross the placenta. There were no teratogenic effects noted on the fetus. However, the fetus can also experience adverse effects. Digoxin also enters with breast milk and therefore can cause potential effects on the neonate. Cardioglycosides work by inhibiting the sodium-potassium ATPase pump. This promotes sodium-calcium exchange in the myocardial cells. The increased intracellular calcium allows for stronger contractions of the heart muscle. This in return results in increased cardiac output. Indications for digoxin. The main indication is for heart failure, mild to moderate heart failure. Digoxin increases left ventricular ejection fraction, allowing for improvement of signs and symptoms of heart failure. This also allows for an increased exercise tolerance. Digoxin can also be used for atrial fibrillation, such as chronic atrial fibrillation, as it aids in control of ventricular responses in patients who are diagnosed with chronic atrial fibrillation. It is contraindicated for ventricular fibrillation and digoxin hypersensitivity. Heart failure is defined as the inability of the heart's ventricles to pump or eject enough blood. This occurs due to functional or structural impairment of the ventricles. When patients present with fluid overload, it is usually known as congestive heart failure. Heart failure occurs due to conditions that can cause the heart to be damaged or overworked. Due to the increased workload, the heart begins to compensate and development of myocardial hypertrophy occurs. This leads to changes in cardiac structures, further increasing cardiac dysfunction. So what causes heart failure? According to the European Society of Cardiology, coronary artery disease affects 2/3 of the patients that are diagnosed with heart failure. The European Society of Cardiology also notes that diabetes and hypertension can contribute in many cases. The National Heart, Lung, and Blood Institute explains that there are other conditions that can cause and lead to heart failure. These include arrhythmias, cardiomyopathy, congenital birth defects, and heart valve disease. There are also other factors that may contribute to heart failure. They include alcohol abuse, illicit drug use, HIV, AIDS, and thyroid disorders. So what are the symptoms of heart failure? Typical symptoms include shortness of breath, orthopnea, paroxysmal nocturnal dyspnea, decreased exercise tolerance, fatigue, and ankle edema. Less typical signs and symptoms include coughing at night, wheezing, weight gain, syncope, and palpitations. So diagnosing heart failure. It is very important for the medical providers to take a comprehensive history to evaluate for heart failure. The health history should include complaints, past medical history, social history, and family history. Medical history is significantly important because there are many medical problems that can lead to heart failure, including ischemic heart disease, hypertension, arrhythmias, valve disease, diabetes, thyroid problems, and others. Social history is also very important because smoking, alcohol abuse, illicit drug use, inactivity, and diet can also play important factors in the development of heart disease. So what is the goal of treatment? The goal of digoxin treatment is to decrease the cardiac workload and decrease the signs and symptoms of heart failure. However, treatments vary in digoxin if it is used for atrial fibrillation. For heart failure, it allows for stronger cardiac contractions. It increases systemic blood flow circulation due to increased cardiac output. It also improves the patient's overall exercise tolerance. It relieves symptoms of heart failure such as pulmonary and peripheral edema. Atrial fibrillation. When digoxin is used for atrial fibrillation, it is used as an antiarrhythmic, and it is approved for dysrhythmias, including atrial fibrillation and atrial flutter. Digoxin allows for a decreased heart rate due to increased vagal tone from the sinoatrial and AV node. Digoxin also slows AV node conduction. Like all other medications, digoxin has various adverse effects. The provider must evaluate and determine if the benefits outweigh the risk. Common adverse effects include fatigue, anorexia, vomiting, and nausea. Life-threatening arrhythmias can occur with digoxin administration. Unfortunately, digoxin has a very narrow therapeutic serum range. This varies from 0.5 to 2.0 nanograms per ml. Felicilda Reinaldo explains that digoxin therapeutic levels should be maintained as close to 1.8 nanograms per ml. The most serious adverse effects that occurs with digoxin toxicity are AV node blocks and extrasystoles. It is important to note that these effects may also occur at therapeutic levels, and patients should be monitored closely when digoxin toxicity occurs. The patient may also experience systemic signs and symptoms, which include anorexia, nausea, diarrhea, headaches, malaise, blurred vision, and yellow halos. Physicians should be notified immediately. So what is the antidote for digoxin toxicity? This will include digoxin immune Fab. The incidence of digoxin toxicity varies from 1 to 30%. In order to avoid digoxin toxicity, the provider's duties must include assessing all patient factors, calculating correct dosages, appropriate administration, family education, and education about signs and symptoms of digoxin toxicity. The antidotes include Digibind and Digifab. Severe digoxin toxicity requires immediate reversal in order to control potential fatal side effects. Digoxin immune Fab binds to digoxin to form molecules that the body cannot absorb. Blood levels of digoxin must be obtained to calculate dosage of digoxin immune Fab. 40 milligrams of digoxin immune Fab neutralizes about 0.5 milligrams of digoxin. So nursing considerations. It is very important for the nurse to evaluate the patient for any comorbidities or current drug treatments that may affect drug clearances. Since digoxin is mostly excreted unexchanged from the kidneys, it is very important to monitor renal function, as patients with renal disease may require a smaller dose. It is also very important to monitor potassium, sodium, and magnesium, as electrolyte imbalances may cause the patient to be at risk of digitalis toxicity and cardiac dysrhythmias. The apical pulse must be taken by the nurse to determine the actual heart rate. If the heart rate is less than 60 beats per minute, the nurse should immediately contact the physician. Monitoring the daily weight and urine output can be indicators in progress of treatment, as the digoxin increases renal perfusion, which in return leads to increased urine output. Patient education. It is very important for the nurses to remind patients with heart failure that they should limit their overall sodium intake. Patients who are at risk of hypokalemia should be encouraged to eat foods that are high in potassium. This includes fresh fruit. Includes fresh and dried fruits, vegetable juice, and potatoes. The nurse should teach the patient to take the apical pulse and to withhold the digoxin if the pulse is less than 60 beats per minute. The patient should also be educated to contact the physician immediately. If there is a weight gain or weight loss greater than 1 kilogram, The patient should also notify the provider. Patient should be explained the signs and symptoms of digoxin toxicity and informed to seek emergency medical treatment if the signs and symptoms are present. Signs and symptoms of digoxin toxicity were explained in previous slides. Due to the narrow therapeutic range of digoxin, patients should be encouraged to wear a medical alert bracelet. Special populations and cultural considerations. According to the manufacturer, GlaxoSmithKline, pharmacokinetics of specific racial populations have not been formally studied. The manufacturer does not expect racial differences as the digoxin is excreted unchanged by the kidneys. It is important to note that there are no significant differences in creatine clearance among races. Renal function must be monitored because patients with decreased renal function may require decreased doses. Culture may influence compliance as medication regimen, as it is noted that patients can be non-compliant due to their beliefs, fear of side effects, and healthcare illiteracy. Socioeconomic factors also play an important role. This can include financial resources. The elderly population are also at risk for noncompliance due to memory impairment, poor eyesight, inability to open bottles, and difficulty swallowing medications. Drug-herbal product interactions. Drugs that may cause some dysfunctions may include amiodarone, verapamil, quinine, tetracycline, erythromycin, and or cyclosporin may increase therapeutic effects. If the patient is on diuretics, potassium should be monitored due to increased risk of electrolyte imbalances, which can cause cardiac arrhythmias. Herbal products include licorice and aloe may increase risk of potassium depletion, and St. John's wort may decrease levels and effects of digoxin. So some research that was done for digoxin in the treatment of chronic and acute heart failure was one based on withdrawing digoxin on patients who are already receiving ACE inhibitors and diuretics. Patients who were kept on digoxin showed no decrease in exercise ability, whereas the patients who stopped taking digoxin showed decreased exercise tolerance. Patients who stopped taking digoxin also experienced worsening symptoms of heart failure, heart rate, increased body weight, and also a decrease in left ventricular ejection fraction. Patients taking only diuretics and stopping digoxin showed the quickest deterioration. The conclusion of the study showed that digoxin improves hemodynamics and decreases signs and symptoms of heart failure when used with other agents. Another research article that I read was digoxin toxicity and diuretics. The aim of the study published in the British Journal of Clinical Pharmacology was to assess digoxin and diuretic interactions. The study is significant because patients with heart failure tend to be prescribed diuretics. The diuretics studied were loop diuretics, thiazide diuretics, and potassium-sparing diuretics. It is well known that digoxin and diuretics interact and cause serious cardiac arrhythmias. However, a cause and effect relationship has not been established. The results of the study suggest that digoxin diuretics was associated with threefold the risk of digoxin toxicity. It is important to note that loop diuretics and hydrochlorothiazide have the highest risk of digoxin toxicity. Lastly, the last research article that I used was digoxin usage and toxicity. The digoxin used to be the previous medication of choice to treat symptoms and signs of heart failure. However, it is currently not the favored medication due to digoxin toxicity and new medications such as angiotensin-converting enzyme ACE inhibitors. Cardioglycosides help with signs and symptoms of heart failure. However, it does not increase the heart rate. It does not decrease the rate of patient mortality. Accumulation of digoxin leading to toxicity can include liver impairment, renal impairment, and drug-to-drug interactions. As stated before, the antidote for digoxin toxicity is digoxin fab. So this is the pamphlet I create. I try to make it as simple as possible. I included what cardiac glycosides are, how they work, the name of the medication, and how it affects the body, what the digoxin is used for, and then, for example, heart failure, and then also signs and symptoms of heart failure. I also included side effects of digoxin. The most common ones are in the box. And then I also included signs and symptoms of digoxin toxicity, which include diarrhea, headache, malaise, blurred vision, and yellow halos. What else? I included food interactions, drug and herbal interactions, and then dosing. Usual maintenance dose is 0.125 to 0.5 milligrams per day. And all it depends on the patient. And this is just a list of the references that I use for all my research in my PowerPoint presentation. Thank you for your time.